is wealth. As the doctors say, prevention is always better than cure. So, in today's episode, we'll be talking about some health issues from our Filipino doctors. Please do stick around. We will be back.
Hi everyone, I'm Dr. Grantos. I am here to share with you some information. I am general practitioner for 17 years, 10 years as emergency room. See, there are so many people around the world who are having diabetes mellitus. According to the World Health Association, there are 425 million of diabetes mellitus. In the Middle East, there are 325 million population of diabetes mellitus. What is diabetes mellitus? Diabetes mellitus is the persistent increase of the sugar. So how to you diagnose the diabetes mellitus? We have to come to the doctor, check the blood sugar. There is what we call the fasting blood sugar, oral glucose tolerance test, and the HbA1c, what we call the glycosylated hemoglobin. In the fasting blood sugar, there should be an increase of more than 6.1%. And then how about the random blood sugar? There should be 11 milligram deciliter. In the hemoglobin, glycosylated hemoglobin, the increase of the more than 6.5%. What are the signs and symptoms of diabetes mellitus? See, we have the 3 P's. We are always telling about what are the 3 P's? The polyuria, the polydipsia, and the polyphagia. Polyuria means you are having excessive urination, more than 2.5 liters. So polyphagia, you keep on eating. You have the voracious eating. You're eating too much. But if you can see, sometimes you are having a weight loss. But you are telling to yourself that, why I'm eating a lot, but still I'm losing weight. So that's what we call the polyphagia. Polydipsia means you keep on drinking water. You are very thirsty always. So this is the most important 3 manifestation that you have to seek consultation to the doctor. So what are we going to do? So it depends on the sugar that the laboratory test will be shown. So if the doctor, for example, one patient will come to me 40 years old who came with how many sugars, like 8 millimole of sugar. So how we will give that? The most important, because 8 is not that much, and the HbA1c is it's having, most probably it's like 8% only. So the doctor, it depends that she will manage on how to give you the medications. Actually, there are 3 types of diabetes mellitus. We have the type 1, this is what we call the child onset, from the 15 years old and below. So this is the usual, the acute onset. In the type 2 diabetes mellitus, this is the adulthood diabetes. This is what we call also the non-insulin diabetes mellitus. There is what we call the 3rd type diabetes mellitus. This is the gestational diabetes. This is what you call during the pregnancy. It can recur for during the pregnancy, but it will go after the pregnancy. So the most important, when you reach the 40 years old during the adulthood, you have to visit your doctor. We have to check the sugar, we have to check the lipids, all the biochemistry. The most important, the lifestyle modification, as I said, diet. And this is Dr. Merlita Grantos. Prevention is better than cure.
find that life is still worthwhile if you just smile, as the song or as the song goes. But how do we really get that Hollywood smile? We'll find out now, as we have here our dentist, Dr. Mary Joy Domingo. Hello to you, Doctora.
Hello.
Thank you for giving us this opportunity to give us just a small peek of what is happening in the dental studio. Okay.
Okay.
So, Doctora, when do we really start having our teeth checked?
As long as for example, for the children, we can check the children's teeth. It's when they are already 2 years old, at least 2 years old, and then start at least a piece of cotton. We can clean their tooth, starting with the water, and then put the cotton cleaning only.
Okay.
That's it.
That will be what age, Doctora?
2 years old.
2 years old.
Yes.
As early as 2 years old.
Yes.
And then how often do we have to have our teeth checked?
At least 6 months.
6 months.
Every 6 months,
So every-
yeah.
Mhm.
For teenagers, they should come to the dentist at least 6 months.
Okay.
For doing scaling. Scaling is for cleaning the teeth, like this. Scaling is to prevent caries and to have a good oral hygiene.
Okay.
This is the purpose of scaling, like this.
What is plaque buildup, Doctora?
Plaque is it's building up when we are not doing proper brushing. Because proper brushing we're doing at least 3 times a day.
Okay.
And then proper brushing, we always start from the gums.
Okay.
For example, we're going to do the brushing on upper. We're doing it, start from the gums, then down. And for the lower arch, it's down to up.
So what is the procedure? Do we have to use just brushing alone is okay?
Yeah, toothbrush at the same time, we need to use at least dental floss.
Dental floss.
Yes,
Okay.
at least once a day we use dental floss, and then use mouthwash.
Okay.
Yes.
So with regards to having our scaling, as you've said, every 6 months. So what are the procedures that you usually do?
We are doing it by using the handpiece of scaling, and then we're removing the plaque itself. And then after the scaling, we're doing it polishing.
Okay.
Polishing is to make it a little bit polished, like there's a glitters on your
They're
smile,
more
like this.
whiter,
Yes,
whiter
yes,
teeth.
yes, and glossy like this.
Okay. So then going back to basic scaling, as you've mentioned, Doctora. So then now that we're doing scaling every 6 months, can we prevent our tooth loss?
Yes, we can. We need to do it every 6 months.
Okay.
And then, because if we're not doing it, even we are brushing, the plaque forms on our tooth.
So that is plaque
Yes.
buildup already.
And then if the plaque forms already, the gums will come down, and the tooth will become mobile.
Okay.
So that's the cause of losing our teeth, like this. So this is the most important in our life, scaling and then do polishing. And then at the same times, we're doing it by fluoride.
By
Like this.
fluoride.
Yes.
So what is fluoride?
Fluoride
Doctora?
is just a protection to prevent caries, to prevent
So
some...
it strengthens the teeth.
Yes, yes. It will prevent only, like this. This is the only purpose of fluoride.
Okay. So how long will the procedure last?
It takes until 6 months. That's why every 6 months we do scaling and then fluoride. That's the routine already.
So do you suggest extracting the tooth if there's tooth decay, or can
No.
can you stop it?
No. First, if it's only small, we can do filling.
Oh, so that's what is
Yes.
filling, Doctor?
Filling is the restoration of the teeth.
Okay.
And
so
then-
what is the procedure that you do?
We'll just put some medicine on this. But if the caries is already big,
Okay.
we need to do the x-ray.
Okay.
So we need to check if the caries already in the pulp. Pulp is the nerve. So we cannot save it by doing filling. We need the root canal treatment.
Okay. And that will be another.
Yeah, another.
Another-
That's why step by
yes,
step.
another topic that we have
Yes.
to discuss. Anyway, thank you so very much for your time, Dr. Mary Joy.
Yes.
And when we come back, you will see the procedure of how scaling is done. Do stick around. We will be back.
Hello, I'm Dr. Emily Zapanta. I'm a pediatric specialist and I'm going to discuss to you about influenza. Influenza is caused by a virus which infects our throat, our lungs, and our nose. It is caused by airborne droplets. Usually we inhale it, or sometimes we come in contact with telephones and computers. Usually the risk factors is age. Number one, for those who are young, and for those who are babies, and those for older people. And for those who are living in crowded places, usually they are exposed to people with flu, and those who have weak immune system, for those who have undergoing cancer treatment, for those who are taking cortisone, and number four, for those who have chronic illnesses like asthma, diabetes, and HIV. For those who are pregnant, they are usually prone to have influenza as well, and for those who have obesity. What are the symptoms of people with flu? Okay, number one would be fever. The temperature is usually high. So the temperature is usually 38 degrees centigrade and higher. Usually they have aching muscles. They have chills and then sweats. Of course, they would have headache as well. And sometimes they would have dry cough. They would have also fatigue and weakness and nasal congestion and of course, sore throat. When do you see a doctor? Usually for those who have flu, they usually treat themselves at home. It's okay as long as you don't have any high risk, or those who have people who have high risk factors, like those who have weak immune system, like those who are pregnant. Of course, they have to consult a doctor for the diagnosis. How about the diagnosis? Of course, by being a doctor, you can treat them by, of course, asking their history, do physical examination. Of course, if they are high risk, you can do some laboratory tests like the rapid diagnostic test that we do. We do get blood from them, and then we do it in the laboratory. It can usually take 15 minutes for the test. For the treatment, of course, usually it is self-limiting. We just have to increase our fluid intake. We can take any acetaminophen or paracetamol if we have fever or if we have muscle ache. Of course, as well as in fluid intake like fruit juices, water. For those who are high risk, they can take also antiviral medicines, which is prescribed by the doctor. About the prevention, of course, we have to wash our hands before and after eating, or when we do some work, no? Like for example, we are doing work in the offices, so after we are done with our work, we have to wash our hands. Or if we are far from the faucet, we can use alcohol containing hand sanitizers. We have to contain our cough and sneezing. We can use our hand or your elbow, no, by covering our mouth. Of course, we have to avoid crowds, and as well as drinking a lot of fluids in the form of fruit juices or water. Of course, we have to rest, and of course, if we have fever and muscle pain, we have to take pain relievers. For the complication, usually for the young and for those who are healthy, we can just do rest, no? We don't have any complications. But for those who are high risk, usually it is pneumonia. The risk factor or the risk are having pneumonia, having bronchitis, having asthma, having heart problem, of course, having ear infection. That's all. And I hope I was able to help you dealing with flu. And I always remember, prevention is always better than cure. Thank you very much.
Every minute counts. Life is why. This is according to the American Heart Association. And why is that? We're going to find out now with my guest here. She's not only a nurse by profession, but she also teaches first aid and CPR. Welcome to my show, Nurse Virginia De Leon Lelix.
Thank
Welcome.
you. Welcome. Thank you.
Okay, so how long have you been doing this teaching CPR and first aid?
I think it's been about 25 years now.
Okay.
And I guess, knowing how to do and what to do during an emergency is very important for everyone.
Yes, as I've mentioned a while ago, every minute counts. It can save lives.
Yes, of course.
Okay, so we'll go to the first question. It's what is first aid?
Okay. First aid is actually what you're supposed to do before help arrives,
Okay.
or when an ambulance arrives. Because most of the time, first aid is the only thing that we can do now until an ambulance arrives and helps you out.
Okay, so then what is CPR?
Okay. Actually, CPR, we only do this one when the person is unresponsive and not breathing. And the letters CPR means cardiopulmonary resuscitation, and it involves two things. And two conventional CPR includes, one is for breathing and the other one is for compression and
Okay.
compression or circulation.
Okay, so tell us something more about this first aid and CPR.
Okay. For today, we're going to be learning at least the basics of first aid. So that means I'm going to be showing you how, or telling you how to call for help,
Okay.
check scene safety, and then of course how to find the problem, because finding out the problem always is the key, okay, on deciding on what to do, especially if this is a life-threatening condition.
Okay, so like how many minutes they should be allotting before the before help arrives?
Actually, when you're already checks for responsiveness, you are only given less than 10 seconds.
10 seconds.
Yes, to
okay.
decide. Okay, to call, not to call. You needed others to help you. But the most important is the less than 10 seconds, because just like what you said, every minute counts.
Every minute counts. Yeah. So when do you decide that you have to call for help?
Later on, when I show you the slides, I will divide it into 3 categories of possible victims.
Okay.
And then from there, okay, I can show you when to call and not to call.
Okay.
Okay?
So that is exciting. Now at least we will know how to be doing first aid or CPR when needed. So when we come back, Virginia is going to demonstrate to us how to do it properly. Stick around, we will be back.
Okay, before we start with the demonstration, Ms. Rowena, I just want to show you and tell you few things about CPR, or before we do CPR.
Okay.
So now that we know already what is first aid, actually one of the most important things to have when you wanted to do first aid is, of course, do you have a first aid kit?
Oh,
Do you have an equipment that you can use, like an AED or an automated external defibrillator? This is a machine that you often see in movies wherein they just put it on the chest and
Okay.
shocks the heart.
I
Okay,
see.
and this is very important in CPR.
Okay.
So, of course, first aid kit is, if you have, and if
It's
you do,
composed of what?
there's a lot of things in the first aid kit, and you can use this one for a lot of things. But the most important is, of course, to have few pieces of things that you will need or you might need during CPR.
Okay.
Number one is like a barrier device. Not everyone will be comfortable doing mouth-to-mouth resuscitation. So
That's
a
right.
barrier device in the first aid kit will be very useful.
Okay.
Number two, if you have, preferably you should have gloves inside, okay, because not everyone will be comfortable touching another person's skin.
You're
Right?
right. Yes.
Okay, sometimes you may need a mask.
Mm-hmm.
Okay, so it depends upon the preference of a person who's going to be doing first aid.
Okay.
So I'll start with the first slide. Okay, the first slide is, I wanted to make it very short because I wanted everyone to understand how to do CPR properly. First thing is the 3 letter C's. Okay.
Letter C. Okay.
Yes, the 3 letter C's. Very
So you have to
important.
remember only C.
3 letter C's.
3
That's
C.
it.
Okay.
Okay. The first one is to check. What do you check? You check to make sure that you are safe. You don't want to do anything wherein you're going to be in an unsafe place.
Okay.
Okay. Number 2, you have to make sure that you check for response. And how do you check for response? Later on in the demonstration, I will show you how to tap the victim's shoulder, because I think there's culturally acceptable for a lot of places globally. Is the only thing that you should be doing is to make sure that you tap the person's shoulder. That's
Okay.
it. Nothing else. And then after that, okay, you have to look at the chest to make sure that the person is breathing or not breathing.
Right.
Because this will help you to decide if you needed to call for help or you needed to call an ambulance.
So this is the part, the deciding factor.
Yes,
Okay.
the first letter C.
Okay.
Okay, now that you decided, you said, I don't know what to do, I'm not sure what to do, or this is a big case, possibly it's a life-threatening condition. Now we go on to the second letter C.
Okay.
Second letter C would mean call for help. Here in Kuwait, okay, we dial the 112 number. So when we dial the 112 number, it's a general emergency number wherein you might need a police assistance. Number 2, a fire department to extinguish a fire.
Okay.
And then of course, for this reason, because we are doing first aid today, so we're going to be calling for an ambulance service.
Okay.
So we called in for help. Okay, when we phone in for help, for sure they will ask you a question. Yes. Okay. So when you care for the victim, okay, so we're going to be doing the demonstration now, Miss Rowena, because we're already done with the first 3 letter C's that I've told you about.
You're right.
And then now we're ready to go.
Okay, let's watch the demonstration.
Now I would like to show you how to do the full demonstration of hands-only CPR. Okay, the first thing is just like what you remembered, the 3 letter C's. First is to make sure that the scene is safe. Tap the victim's shoulder. Hey, hey, are you okay? You look for the chest rise. This takes only about less than 10 seconds. No breathing, no response. Call the emergency number and start doing compression. Go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 13, 14, 15, 16, 17, 18, 19, 20. You will be continuously doing this one at a rate of 100 to 120 without any process until help arrives or a barrier device from the first aid kit.
Thank you very much, Miss Virginia, for showing us how to do CPR properly. I'm sure it's going to save lives.
Okay, thank you for having me, Miss Rowena.
Okay, until next time. And that concludes our episode for today. Till next time, this is Rowena. Mabuhay!